Hi, I'm the Director of Pharmacy here to talk to you about pharmacy services. The first slide talks about the pharmacy hours of operation. We have several pharmacies on site, so bear with me here, but the main pharmacy is open 24 hours a day, 7 days a week, and the phone number is listed. We also have an operating room pharmacy satellite, which is open 7 a.m. to 3:30 p.m. Monday through Friday. We have a campus outpatient pharmacy that's open 9 to 6 Monday through Friday. This is a retail pharmacy. It's open to the public. We are also in the process of opening a Vestal outpatient pharmacy service that's going to be open 8 a.m. to 8 p.m. daily, 7 days a week. We do not have a phone number yet for that, but we will update these slides when we do. The last pharmacy I want to talk about is our Hope Dispensary. This is a free pharmacy for those that qualify, and it's open 9 a.m. to 5 p.m. Monday through Friday, and the phone number is listed. There are certain people that you should have the phone numbers for. These are the elite of pharmacy. And I thought that I would list all their names. Of course, I am at the top. I'm the director of pharmacy, and my number is listed there. The other person is our operations manager. She's also our buyer, and so if you have any questions about formulary or if we can get something or if how much something costs, she's a good person to know, and that person is Shirley Simic. Grant Knickerbocker is my clinical pharmacy supervisor. He oversees all of my clinical services. So if you have any questions, especially about antibiotics or different clinical services, you could call him at 798-5268. He's a great resource. Another great resource is my IT pharmacist, Gene Hoff. A lot of you will be using CPOE, computerized physician order entry, and she's sort of the guru from the pharmacy end of things. So if you have issues or things like that, she's a good resource there as well. I have several supervising pharmacists in my outpatient clinics. Tom Forrest is my campus. He's the pharmacist, lead pharmacist in our on-site pharmacy. Then Todd Landry is going to be my supervising pharmacist at the Vestal site, and then Stacy Tripp is the head pharmacist over at the Hope Dispensary. I want to talk a little bit about our hospital formulary. It is considered a closed formulary, but that doesn't necessarily mean that you can't get a medication if you need it. We do use patients' own meds at times, but we try not to use these as best as possible because we want to control our supply chain. There is a way to get to our formulary. It is on the INTRAnet. You just have to log into the Lures INTRAnet homepage, click on the Departments tab, which is at the top, click on Pharmacy, and click on Online Formulary. The note, the formulary is categorized by class of medication. It is in a Excel spreadsheet, so you can use the find functionality to find the medication that you're looking for. I am the secretary of the Pharmacy and Therapeutics Committee. We are always looking for great new physicians and practitioners to join our committee, mid-levels as well. The P&T committee meets the second Monday of every month. We oversee all formulary medication decisions. We oversee the medication utilization. We oversee all medication-related national initiatives, things that are coming out of Ascension Health. And we always are looking for membership if interested, like I said. So please let the medical staff office know if you're interested. This committee is a very active committee. We're already a couple months into this year, and we've already done over 10 formulary reviews. Not everything makes it onto formulary, so if you want to be a mover and a shaker and part of the process, please let the medical staff know. Another thing that I like to talk about is our antibiogram. We have several antibiograms. They're updated annually. They are all located on the INTRAnet. We have an all patients except ICU, all non-urine isolates, which is your sort of general typical antibiogram. We also separate out the common urine isolates so we can look at the urines and see what's going on there. We do have a separate one for ICU patients as well, so we could see if there's greater resistance in our ICU area. And we do take a subset of our nursing home patients and look at those isolates to see if there's more resistance coming out of our nursing home population and vent patient population. So we have that as well. So all four of those are on the INTRAnet. You can get to it by clicking on departments, clicking on pharmacy, and the antibiograms are located in the middle of the page. Again, they're in an Excel spreadsheet format. So when you look at the antibiogram on the page, you can actually click on there's different file folders at the bottom of it so that go through the different antibiograms. So please make sure to do that to get to the different ones. The last thing I want to talk about is our approved therapeutic substitution lists. We have a pretty extensive list, although if you're coming from other institutions, some of them institutions have a greater list than we have, but we do try to be pretty inclusive. I'm not going to go over this in detail. It's all here for you, but there are basically certain medication classes where the pharmacy will automatically substitute from one medication to the other medication. All of these are approved through the P&T committee and the Medical Executive Committee for Pharmacy to do. So you need to make yourself aware of these. The first one is the statin group. The HMG-CoA reductase inhibitors are pretty much our workhorse is Simvastatin, except for the 80 milligram. There's been some data out there to show that converting to the 80 milligram is not the right thing to do. So we do have Atorvastatin as well that we do convert to. The second one is the PPIs, or our proton pump inhibitors, where our workhorse currently is Pantoprazole, which is the 40 milligram strength. So we're converting all of our other medications to that one. Um, the next group is the Angiotensin Receptor Blockers, where Valsartan is our workhorse. The next is our H2 receptor blocker group, where Famotidine is currently our workhorse. And then we have the Oral Angiotensin Converting Enzyme Inhibitors, or ACE inhibitors, and how we convert is listed there as well. That's a little bit more complicated. Our 5-HT3s, which our workhorse currently is on Dansitron for both IV and oral. The anticholinergic inhalers, which ipratropium MDI is converted to tiotropium, and ipratropium albuterol, which is a Combivet inhaler, is converted to tiotropium plus albuterol. We do not keep Atrovent, and we do not keep Combivet in the building. They are all converted. The hematopoietic agents, Ironusp is our workhorse. Our carbapenems currently convert to meropenem. Insulin, we are a Novo hospital, so we convert all of our Lilly products are converted to Novo products. So for example, Humulin would be converted to Novolin, Humalog would be converted to Novolog. The only exception to that rule is Humulin U500, which does not have an equivalent in the Novo family, so we do have Humulin U500 in stock. The other insulin I want to talk about is Glargine Lantus, which we do convert to Detamir Levemir. So all of our Lantus is converted to Levemir here at the hospital. We do not carry Lantus any longer on formulary. And the last one on this page is our quinolones, which levofloxacin is currently our workhorse. So we do try to convert all of our quinolones to the levofloxacin family. The corticosteroid inhalers is another complicated one, so just make yourself familiar with that as well. On the page, our histamine H1 antagonists, we currently convert to loratadine, and if the patients are less than 2 years old, we convert to cetirizine. Tapentadol, Nucynta, is converted to oxycodone. We do not carry Nucynta on formulary. We do not allow that medication to be used in-house. And then we, in light of all of the acetaminophen issues, and actually it's gone legal now to remove all of the 500 milligram and greater combination products to a 325 milligram product, we do convert our hydrocodone APAP, which was the 500 was considered Vicodin, to the 325 milligram product. So that does happen for you, unless we do have all of this, just so you know that all of this is also in CPOE. So if you're using CPOE, it does help you through these interchanges, because it does tell you that we will be interchanging that product and give you the ability to do it right there instead of having us do it in the pharmacy. So that's the end of my talk here. So on behalf of the pharmacy staff, I would like to welcome you to Lourdes Hospital. Thank you.